Tylenol, ibuprofen, aspirin. Have you ever asked yourself, are these medications safe to take? Picture yourself in the gym with your friend. Your friend complains of a headache. You go to your locker and you proceed to pull out some Tylenol that you have in there and you give it to your friend. You continue on with your workout. About 30 minutes into your workout, your friend is having difficulty breathing. You ultimately end up having to call 911. Your friend is having a severe allergic reaction to this medication. Through my education at North Idaho College, I have the proper training on when it's not okay to take this medication. And I also was trained that you should never dispense medication without a physician's order. Tylenol, ibuprofen, and aspirin. Today, I will cover improper dosages, lack of knowledge about these medications, and the legal consequences if you do in fact dispense this medication and something terrible happens. Now, from listening to news clips, we have heard the difficulties that exist with prescription medications and people trying to sell them on the black market, taking more than what is actually prescribed. But we should also focus our attention to the over-the-counter medications and the problems that exist with them as well. Most people do not read the labels on the back of these medications. On the back of these medications, it has the dosages, the warnings, the frequency, and when to notify your physician. So everybody should read the entire labels on the backs of these medications. Now, do you know your health issues? Do you have kidney disease, liver disease, high blood pressure? Do you currently take any medications such as blood thinning medications? If you take these medications and then proceed to the over-the-counter medications, you could potentiate these problems. Like if you have kidney disease and your drug of choice is the ibuprofen, you could ultimately end up doing more damage to your kidneys. Now, if you're taking blood thinners and your drug that you want to take for the day is aspirin, you could ultimately end up they potentiate each other, and you could end up with extremely dangerous level of thin blood, and you could end up with bruises all over. And if you're in a car wreck or trip and fall down, hit your head, you could suffer the consequences that way and ultimately die. So you need to consult your physician before you take these medications. Most people think that because you can buy them from a grocery store or over the counter at the pharmacy that these medications are safe. And it all depends on your health and if you have discussed this with your physician. Long-term use of these medications can also potentiate problems. Like if you have a fever for 3 days in a row and you've taken the Tylenol and the ibuprofen and you continue to have the fever, you need to go see a physician. And those warnings are all on the back of these medication bottles. Nurses with 4-year degrees have been taught that you cannot dispense this medication without an order from the physician. Ultimately, that even means a 4-year degreed mother, and you should consult your physician before you give this medication to your children. Now, whether or not you have a license or a certificate or a teaching degree, consequences may occur if something terrible happens from giving these medications to people, like a teacher giving a student that's complaining of a headache a Tylenol. If they have an allergic reaction or they're already on other medicines that the Tylenol doesn't interact well with, they could end up having more health issues and you could be in trouble. So you never know when somebody is going to have an allergic reaction to a medication. They could be taking Tylenol their entire life, and one time they take a dose of it, and boom, all of a sudden they're in the middle of an allergic reaction. So next time somebody asks you if you have a Tylenol or an ibuprofen, you might want to think twice before you answer. I hope you have learned some interesting facts about these over-the-counter medications, and if you learn nothing else, I hope you have learned that you should always consult your physician before you take these medications. I, myself, have worked too hard to get my license to lose it all over a Tylenol, ibuprofen, or an aspirin. Thank you.